Now, 18 months ago, we couldn't have imagined that face masks would become part of our daily lives. But up until today, they've been a legal requirement in shops, restaurants and public transports for nearly a year. Well, that's up until yesterday.
Yeah, they're no longer mandatory in England. But for places where masks will still be worn, such as children's hospitals, they are being swiftly adapted. For instance, staff at Alder Children's Hospital are the first to wear a transparent face mask to help young patients feel at ease.
Well, with us now to talk about those new masks is Iain Hennessey, paediatric surgeon and clinical director of innovation at Alder Children's NHS Foundation Trust. It's a great pleasure to talk to you. Just explain. I mean, a see-through mask, it's obvious how they work, but can you just perhaps show us one and how clearly we would be able to hear and listen and see what you're saying?
Okay, so this is our mask. Okay. An idea behind it is you move the filter material away from the face so that you can see your smile, basically. You got to remember, this is what we're having to wear all the time. Is these things, and that's for the foreseeable futures in healthcare. And now we've got this so that we can show our face. And it must admit, it was lovely the first time I showed it to a child, and I smiled at them, and they smiled back, because I'm not used to that, because I've been wearing a mask all this time.
And how important is it for children, you know, especially children who are hospitalised? That must be so frightening for them. How important is it to be able to see those facial expressions and actually, you know, clearly be able to communicate with the people caring for them?
Yeah, and I hadn't realised how much I'd lost, actually, from just these kind of micro expressions. I know you think this is quite a scary face, that you don't want to see this face, but it's really important for children. And it's not just important for the children, it's actually important for the entire family. One of the things about paediatrics is that you have to get a rapport with a child and a mum and a dad and a granny, because otherwise, if the child doesn't like you, the mum doesn't like you. If the mum doesn't like you, granny doesn't like you, and then you get a really bad interaction. So for us, it's been critically important to keep our patients safe by having masks, but also to try and get rid of some of the downsides of masks, which is the fact that you can't see through them.
Well, it was fabulous just when you put it on to be able to continue the conversation and to see you and to see you smiling. And it's not just children; it's all of us, isn't it? We've perhaps forgotten how much we rely on the face and being able to see the lips move, and not just to hear what people have to say. And for children, 10 times so.
That was a big thing because the idea was brought to us, you know, that we needed to have this by one of our speech and language therapists, Wendy, because it's a key part of her job that people can see her face so that she can explain to them how to speak. So it's not just about having a clear panel, it's about the fact that your face can move normally. So when you put it back on again, just to show you, my mouth can just move in a normal sort of way. And you can see the micro expressions around the nose, around the corners of the mouth. So you've got a full, clear view of the face, and at the same time still having the filtration component of it, which is the equivalent of a type 2 medical mask, which is what we wear.
Is it as safe? Is it as effective as a cloth mask?
Yeah, so we've had it go through the MHRA, which is the Medical Health Regulatory Authority, and we've had it tested as a type 2 medical device. Because what we wanted something as good as this, you know, it's an equivalent to this, but see-through.
Yeah, is that more comfortable to wear as well? Because it actually looks like you've got a bit more room and it's not going to be as sort of claustrophobic for the wearer.
Yeah, and so it's nice because the idea was to move it away from the face as well, you know, so that we've got a fair amount of space in front of the face, and you still have ventilation as well underneath it. So the trouble is that these things, I've been wearing them for the past 20 years, because as a surgeon, you wear a surgical mask when you're operating. So I've just got used to this. And it was interesting at the start of the pandemic, and everyone else had to start wearing masks, and they just couldn't abide them. They couldn't stand them on their face. They were touching them all the time. And it was like, you know, it's just this normal thing for us. So yeah, we're getting used to them.
Just that moment where you're talking to children, and often very difficult conversations. This must make all the difference. Yeah.
There's a lot of, you know, very difficult conversations you have to have in children's healthcare. And, you know, I must admit, I do feel that I lose something by not having facial expressions on show when we're having to use these type of masks. I mean, you can convey an awful lot with your eyes and your tone, your voice, and everything else, but there is something about having the full range of expression. And really, we're just trying to get the best of both worlds. We're trying to have the benefits of the protection of the mask, because we were going to need it in hospitals for the foreseeable future, but try and get back some of the benefits of having your full face on show.
So you'll be having this at Alder soon, which is great news. Are you now planning to roll this out to other hospitals or potentially even schools?
Yeah, so it's not just going to have healthcare applications. I mean, just today, I was chatting to someone in the shop, and when I went outside and I was speaking with them and had my mask off, it was like the conversation was easier. So I think for any form of industry, this will be useful if you're public facing. We're rolling them out in Alder right now, but the aim is to ramp up production and get as many hospitals as possible.
Well, Iain, wish you all the luck in the world with this, because it's so simple, and the brilliant ones always are, aren't they? And it's really good to see you properly, and wish you well with all the work, really important work that you do there. It's nice of you to join us. Thank you, Iain Hennessey.
Thank you.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.